Hey everyone, and welcome back to the channel. Today we're diving into a topic that affects millions of people every single year: respiratory infections. I know it might not sound like the most glamorous subject, but understanding it is super important for keeping ourselves and our loved ones healthy. We've all had a cough or a sniffle, but when does a common cold become something more serious? Let's talk about it. So, what are we even dealing with? Respiratory infections are illnesses that affect your nose, throat, and lungs. They're usually caused by viruses or bacteria. You've heard of the big ones, like influenza, commonly known as the flu. Then there are others like the common cold, bronchitis, and pneumonia. While some of these just leave you feeling under the weather for a few days, others can be much more severe, especially for certain groups of people. Let's zoom in on influenza for a moment, because it's a perfect example of how serious these infections can get. The flu isn't just a bad cold. It can hit you like a ton of bricks with high fever, body aches, extreme fatigue, and a nasty cough. For most healthy adults, it's a rough week or two, and then you recover. But for young children, older adults, pregnant women, and people with chronic health conditions like asthma or heart disease, the flu can lead to serious complications. We're talking about things like pneumonia, which is an infection of the lungs, inflammation of the heart, brain, or muscle, tissues, and even multi-organ failure. It's a chain reaction where the initial flu virus weakens your body's defenses, making it easier for other, more dangerous infections to take hold. This is why you hear health officials urging people to take the flu seriously every single year. So, how do these tiny invaders spread so easily? It's all about droplets. When someone who's sick coughs, sneezes, or even just talks, they release tiny droplets containing the virus or bacteria into the air. If you're nearby, you can breathe these in. You can also get sick by touching a surface that has the virus on it, like a doorknob or a phone, and then touching your own eyes, nose, or mouth. It's incredibly efficient, which is why these illnesses can sweep through schools, offices, and entire communities so quickly, especially during the colder months when we're all spending more time indoors. Now, for the most important part, what can we do to protect ourselves? The good news is there are simple, effective steps we can all take. First and foremost, wash your hands. It sounds basic, but washing your hands with soap and water for at least 20 seconds is one of the best ways to remove germs. If you don't have soap and water, then alcohol-based hand sanitizer with at least 60% alcohol is a good alternative. Try to avoid touching your face, especially your eyes, nose, and mouth. That's the main entry point for germs into your body. Also, think about your environment. When you can, keep your distance from people who are obviously sick. And if you're the one who's feeling unwell, do everyone a favor and stay home. This prevents you from spreading it to others. When you cough or sneeze, cover your mouth and nose with a tissue or your elbow, not your hands. This simple act of etiquette is a powerful public health tool. And of course, staying up to date on recommended vaccinations, like the annual flu shot, gives your immune system a major head start in fighting off these infections before they can cause serious problems. Building a strong immune system is your long-term defense strategy. This means getting enough sleep, eating a balanced diet full of fruits and vegetables, staying hydrated, and getting regular exercise. Managing stress is also key, as chronic stress can weaken your immune response. Think of it as training your body to be a better fighter. It's crucial to know when to seek medical help. If you have a high fever that won't go down, difficulty breathing, chest pain, confusion, or if your symptoms get better and then suddenly return with a vengeance, it's time to call a doctor. Don't just try to tough it out. Early medical intervention can make a huge difference in preventing serious complications. And if you're ever feeling overwhelmed or anxious about your health, please reach out to a healthcare professional. Your mental well-being is just as important as your physical health. Thanks so much for watching today. I hope this information helps you stay safe and healthy this season. If you found this video helpful, please give it a thumbs up and consider subscribing for more content just like this. Stay well, and I'll see you in the next one.